Developing news now on Capitol Hill. We mentioned this a moment ago. This could be significant in the health care battle over reform. Reports out of Washington now suggest the House Speaker, Nancy Pelosi, does not have the number of votes needed for a robust public option for government-run insurance. If that's the case, where will Democrats tack next on the issue? And what might happen on the Senate side? That's where Bob Corker works, a Republican senator out of Tennessee. And welcome back, Senator. Good morning to you. Bob Casey, a Democrat from Pennsylvania, your colleague on the air with us just about an hour ago. What does this mean?
Bill, always good to be with you.
Yeah, and welcome back to you as well. What does this mean? Is it falling apart on the House side, or is there a backup plan for Democrats?
Well, you know, I can't predict what's going on the House side. I have no idea what Speaker Pelosi is going to announce today. What I can say that on the Senate side, I think we saw the first step in health care. And, Bill, you couldn't make this stuff up. I mean, on the floor this week for a health care reform bill that was supposed to be absolutely budget neutral, not add one dime to the budget, the very first act by the administration and by our leader, the majority leader, was to put a bill on the floor that added $254 billion, $250 billion to our national debt, because we here in Washington do not have the courage to deal with issues that relate to our other public issue, which is Medicare. And for anybody in this country to think that we would behave differently with any other type of public option, just look at the way we've dealt with Medicare and Social Security.
That option is the doctor fix that you're referring to. And, you know, critics are saying you're just going to kick the can down the road for another time. Democrats would say, I mean, before you were in Congress, that Republicans passed a Medicare prescription benefit that was not funded either to the tune of, I don't know, $300 billion. I mean, is that fair blame to go around, Senator?
Oh, there is no question. There is no question. Look, this is not just limited to Democrats. It is today because they're in power. But no, Republicans in 2003 did exactly the same thing. And the fact is, again, this is the thing that should concern all of us about a public option, because in Washington, what we want to do is give people the things that they want, but not cause them to pay for it. We have, and what we're doing is incredibly selfish, incredibly self-centered, because what we're doing is basically trying to give people what they wish today, what they want today, but we're kicking the can down the road and really throwing future generations under the bus. Bill, this week, to me, that move was one of the most sinister I've seen since I've been here. Have both parties engaged in that? Yes. But I think all of us need to have our antenna up during this health care debate that's coming up over the next 2 months to make sure. Go ahead.
You were emphatic about your opposition to that on the floor of the Senate earlier this week, and we were listening to you. But I'll come back to a moment to this public option. There are those who now suggest that the debate shifts, whether it's on the House side or the Senate side. It shifts from a robust public option that would actually be written in the law into what's called a trigger mechanism, which would allow the states either to opt out or get on board based on what the insurance industry does, say 2, 3, 5 years down the road. Is a trigger option the ultimate outcome? And if so, what does that mean for health care for Americans across this country?
Well, I mean, I think you hit the nail on the head. What does that even mean? I mean, this is getting into sort of funny land here. But let me just mention something. Yesterday, the Blue Cross organization, which is highly respected in our state, they're not one of those big, bad, private, for-profit entities that people on the other side of the aisle talk about. They say the provisions that are in this bill are going to cause rates in Tennessee over the next 5 years, forget inflation, just base rates, to go up 60%. So much of what is being designed in this health care bill is almost going to drive people into other places. I think that very soon Americans are going to wake up and realize that if a trigger mechanism were in place, and again, Bill, I don't even know exactly what that means, but we're going to have something happening on the private side that's going to drive rates up because of this legislation that might well automatically move people into a triggered public option. But again, I don't understand the details yet of what a triggered public option even is, and it keeps changing on a daily basis.
It appears to be a moving target. You're right about that. But one of your colleagues, the Republican senator from Maine, Olympia Snowe, apparently supports this, and we're getting reports that President Obama gave the green light to at the White House last night. So whether we understand it or not, we're going to have to figure it out pretty soon to figure out what it means to us, Senator.
Well, I think what we need to have is the language, and I think all of us, again, this is more of a political debate, Bill. I mean, what's happening is Speaker Pelosi and others are trying to make sure their base hears the word public option. You know, we have the senator from Maine, I think, who's trying to keep a public option from actually occurring. But I think all of us need to look at the details of this as it unfolds. To really respond in a detailed way to it right now would just be almost superfluous at this point. But let me say this.
Please.
I'm glad you're paying attention. I hope America pays attention. I think they saw the first step in health care reform this week, and I don't think it was particularly pretty.
Well, I tell you what, it makes my head spin every morning trying to figure this stuff out. I can just imagine what it's like for you on that side. Figure out that trigger option. We'll talk about it next week or sometime very soon, Senator. Thank you, Bob Corker.
Thank you, Bill. Thank you.
Out of Tennessee.
Yes, sir.